Ya kwanza, I'm the first lady Kakamega County. Wale hawajui waniangalie vizuri, wanijue. Si ndio? Ya pili, I'm a friend to the Bishop Reverend Ross. Ya tatu, all the warriors are my children. So I'm here as their mother. Thank you. Naomba mniruhusu nisome speech yangu kwa haraka kwa sababu najua hawa warriors wamechoka. Ladies and gentlemen, thank you for joining us today here in Butere Sub-County for this important event. This day is dedicated to raising awareness and sharing information about sickle cell disease within our communities. I'm truly honored to stand before you as we address the challenges faced by our community, especially the brave individuals who battle sickle cell disease every day. Today, we also highlight and share our success stories in the fight against the disease. As the nation marks the National Sickle Cell Disease Awareness Month, here in Kakamega County, we do so with unwavering commitment to a future in which people with the condition live fully, without pain, without impediments, and ultimately experience cure. Sickle cell disease is a complex and often misunderstood condition that affects countless lives around the world. It is an inherited disease associated with abnormally shaped red blood cells, and it is not infectious. Unfortunately, our region has had a high number of sickle cell warriors who have to confront the challenges of the disease with strength and resilience every day. In Kakamega County, we are all aware of the significant impact it has in our communities. Last year alone, for example, Kakamega County recorded 361 newly diagnosed cases in our registry. In fact, all our 12 sub-counties recorded new cases, with Matungu sub-county recording the highest number of new warriors, about 80. Ladies and gentlemen, as we gather here today, we must acknowledge two critical challenges that we face in the war against sickle cell disease. That is, the lack of access to proper screening or diagnosis and the unavailability of essential drugs. Lack of essential drugs is a pressing concern that we cannot ignore. Proper medical care and access to necessary medications are paramount in managing the symptoms and complications of sickle cell disease. No individual should have to endure unnecessary pain and suffering due to lack of medication. Therefore, it is our responsibility to advocate for improved access to these life-changing drugs, ensuring that our sickle cell warriors receive the care they rightfully deserve. Distinguished ladies and gentlemen, screening is the first step towards early detection and effective management of sickle cell disease. It empowers individuals and families with the knowledge they need to make informed decisions about their health. It is, however, disheartening to know that many among us still lack the access to proper screening facilities. This is a challenge that we must collectively address, as early detection can significantly improve the quality of life for those with sickle cell disease. In addressing these challenges, we must unite as a community. We need to work closely with healthcare providers, government agencies, non-governmental organizations, and other stakeholders to create a comprehensive strategy that tackles the issues of screening and drug availability. Health education and awareness campaigns should also be identified to dispel the myths and misconceptions surrounding sickle cell disease. By fostering a culture of understanding, we can eliminate the stigma associated with this condition and create an environment of empathy and support. In this view, therefore, I want to sincerely thank the Don Amor Foundation for donating the sickle cell screening machine valued at around 2 million shillings. Terrace Account Hospital becomes the first hospital in the county to offer screening services for sickle cell disease using the HB electrophoresis machine. Ladies and gentlemen, staying healthy with sickle cell disease involves the following: pain management, self-care including eating well, exercising, and drinking a lot of water. We saw those singers singing to us like that. Avoiding alcohol consumption and smoking. Protection from common illnesses such as common flu and malaria. Taking medications to reduce severity of the sickle cell disease. Regular preventive care including vaccinations and health and dental wellness checkups. Quality medical care from health workers who are educated and well informed about the disease. Building a support system of friends and family. Connecting with patient support groups or community-based sickle cell disease organizations for information and assistance. And lastly, taking precautions during air travels. For example, if you have to travel in an unpressurized aircraft, then talk to your doctor about extra precautions. Therefore, let us take this opportunity to come together and make a lasting impact to our community. Together, we can ensure that sickle cell warriors in Kakamega County and beyond receive care, attention, and support they need to lead fulfilling lives. Let us be their advocates, their allies, and their voice. In conclusion, I want to urge the Department of Health to help us do the following. 1. Prioritize sickle cell disease prevention and treatment interventions, and develop initiatives for research, surveillance, prevention, and treatment of heritable blood disorders. 2. Ensure availability of supplies of the medication required by our warriors. 3. Intensify health promotion, education, and awareness campaigns on sickle cell disease. And 4. Develop a bill to subsidize the cost of medication for the warriors. To my sister and friend, Your Excellency Mama Dorothy Nyong'o, to all our partners and stakeholders, thank you for your dedication to this cause and for being part of this crucial moment. Together, we can make a difference that will resonate well for generations to come. Thank you very much.